I promise it will be a shorter meeting, but nonetheless very informative. We have a lot to tell you. So let's, can I move these? Oh, you're moving the slides. All right, so just introduce yourself in the chat. We really don't have too many people on the phone. John Perkins already said hello to you. Kristen Phillips from Haney's is on the line. Our speaker, Melissa Bauer, is on the line, Brooke and I. And then Tom McKinley from Healthix was having some audio troubles. He was going to call in again. And I think I identified everyone. Did I miss anyone?
We also have Michelle of
Michelle.
Styles.
Hi, Michelle.
Hi, how are you? Happy New Year.
Happy New Year.
Happy
Hi.
New Year.
So, well, I basically just introduced everyone, so I guess you don't have to introduce yourselves in the chat unless you'd like to. I'm Janine Logan. I'm the director of the Long Island Health Collaborative and vice president of communications and population health for the Nassau-Suffolk Hospital Council, which oversees the Long Island Health Collaborative, the region's population health initiative. And Brooke Olivieri, see if I get this title correct, is, you tell them, Brooke, Manager of
Communications, Health Outreach, and Research.
Right, for the collaborative and for the council, which oversees the collaborative. So that's who we are, in case you didn't know who we are by now. So happy New Year to everyone. I hope you had some time to rest. I hope everyone is feeling okay and everyone in your family is okay. And here we are in another year and dealing with COVID still. We're warriors. We're getting used to it.
That's right.
Okay. So what we're going to go over today is, let's just go back one slide.
Oh, sure.
Here's the agenda and what we're going to go over. Our timeline is getting shorter, which is great because we're meeting milestones as we move along. So we'll talk a little bit about that. We'll talk about the surveys that we have out there to collect information, both from individual community members and from community-based organizations. That's ongoing. And then we will talk about Sparks data. We'll hear from Melissa Bauer from DataGen, who'll talk about what we hope to do with the Sparks data that we have. Okay, we can move on. Okay. So the timeline. Last week, the update to the prevention agenda, the 2021 update is due. I assume everyone was able to get that done. So we now have that behind us. We're moving along, as I said, and collecting community-based, hi Stephanie, hi there. Community-based organization surveys, which we hope we'll be closing that survey in a couple of weeks. And the idea between mid-January and mid-March, we will, in a frenzy, complete the key informant interviews with those CBO surveys, those individuals who indicated their willingness to talk to us. And at the same time, we will be analyzing the individual community health assessment survey results in that time span, so that by the end of March, beginning of April, we can convene, look at all the results, and as a group come to consensus on what the two priorities will be moving forward, on which we will focus our efforts. I'm going to say they're probably not going to change much from what they currently are, but we will look at the data and the data will drive the decision. We'll go to the next slide. To date, we've collected 35 responses from CBOs, which, if you recall, last month, I think we were at half that number, 18, 16, 18, and my goal was to double it to 36. So we're pretty close to hitting our target goal. Certainly, we would love to go beyond that. 19 of those who responded have said, yes, we can contact them. And listed here are the organizations that responded. Some, there are not 36 organizations listed per se, because some respondents were duplicates, different people from the same organization, which is fine. And some individuals did not name their organization. So they responded, but unfortunately, we don't know who they are. We have their zip code where their organization is located, but that's about all, the only way we could identify them, right? Brooke, nobody, unless they put their name down, which they didn't do that.
Right.
So we're going to continue to forge ahead, collecting those CBO surveys. I think if we go to the next slide. Yeah, all right, we'll talk about the community health. Well, no, go back to the CBO survey. We'll talk about that. So the CBO survey is pretty much mirrors the community health assessment survey, the one that is seeking information from individuals. And we are going to be able to get a little bit more in-depth analyses and an in-depth understanding of our community-based organization partners when we do those key informant interviews. At this point, 19 individuals said yes, that we could contact them. I never expected 19 to say yes, we could contact them. So that puts Brooke and I in a little bit of a bind, as at this point in time, we're the only ones who would be conducting these key informant interviews, and then having to run it through the Atlas TI qualitative analysis software. So we were hoping to get an intern in from one of the colleges. We're close to getting one from Stony Brook, although it has not been confirmed yet. So I'm hoping that that happens and they'll be able to help us out. And we have heard from some other colleges who are interested in placing interns, although nothing's been solidified at this point. Oops. Let me just turn that off. Okay. So it'll be a little bit of a challenge for Brooke and I. I did talk at one point, and I know everybody's stretched in their own positions, in their own jobs, and I know COVID is not making things any easier this year than it did last year. But if anyone would want to volunteer to maybe handle a couple of those key informed interviews, we would be most appreciative of the assistance. So if you want to, it's like maybe a 5 to 6 questions, you record it on Zoom, and if you have time and you want to do that, and then we'll take it from there, that would be helpful if you can. Otherwise, Brooke and I will forge ahead as a team and we'll get it done. Again, if we are depending upon our partners to reach out to the community-based organization leaders with whom they work, because that's the best way to get responses. So if you don't happen to see an organization that you work with on this list and you really feel that they should be contributing and have something very important to say, and well, everybody has something important to say, please reach out to them and nudge them, give them that survey link and ask them to complete the survey. We do, when we go a couple of slides forward, we do have resources for you in terms of if you're going to post about it on your social media channels. We're also going to be supplying in that toolbox some sample copy that you can pop into an email and send off with the link to individuals with whom you work closely in the CBO space. So we still want more, the more responses, the better. We want to keep this open until mid-January, January 15th, 16th or so, around that time. And then we'll have to stop it to give us time to do the interviewing and the analysis. So let's go to the next slide, is talking about the individual survey, which we really have a pretty good response for 2021. Linda's got a question in the chat. I'll answer that in just a second, Linda. When do you want to do the interviews? Okay, I'll answer that in just a second. This response we have for all of 2021, I would say is probably 4 or 5 times greater than what we had in 2020. And we all know why that happened in 2020. Even so, I think this is a respectable response for 2021, considering that many organizations were still operating their programs remotely. Some weren't even holding programs. So this, I think, is a really great response. It's a credit to everyone who's been pushing it out through their own social media channels, to their own clients and their own patient base. So we appreciate that, and we're good. That survey has finished now for 2021, but we always continue the survey on an ongoing basis. But our analysis will only look at those 1,105 responses from 2021. Okay, let's go to the next. Now, Linda had a question about when we would want to interview the community-based organization leaders. So I would say if we close the survey in like a week and a half, the 15th, when is that? It's a Saturday, say around the 15th, we want to start interviewing immediately the following week. And the way I do it, I'll provide all of this, is to send out an email to the individual reminding them that you had said you were willing to speak to us, et cetera, and then provide them with perhaps a choice of a few dates, or ask them to give me a few dates and times, and then follow up with them to solidify it. I usually reach out 3 times. I'll do an email. If I hear back right away, that's great. If I don't, then I'll do a phone call, and hopefully that does it, and I make the connection. And then if I'll do a 3rd phone call. And after 3 tries, then I give up. So that's the process I follow. But I would say, Linda, we want to start as soon as we're done on the 15th. We would want to start that following week. And I do have the questions that we're going to be asking the CBOs who are interested in providing us with more information, and I can share that with anybody who's interested. All right, let's see. Okay, let's go to the next slide. Okay, so for today, if you recall, Sparks data, I don't have the access to the Sparks data that I used to have because we are no longer funded by the state to be able to access that data. But we did a 2000, I'm going to say, was it 16, 17, 18 analysis about a year or so ago. And the analysis was based on a number of diagnosis codes that were selected from among the members of this subgroup to look at those particular diagnoses. And we provided first, if I remember correctly, we did an analysis, and then there was some issue with the 17 and 18 data with the state. So we had to remove all that data. We just did our CHNA that last time around on the 2016 data. Then the state corrected their issue. We refreshed the data and had 2016 to 18 later on. So that's available on our website. And when we do the hospitalization analysis, and it's by county, right, for Nassau County and Suffolk County, each county has identified within their counties select communities or high need communities based upon a criteria of selection that they use. And I think in Suffolk, it's maybe a dozen, and Nassau, maybe 10 or so. Those are the select communities or the other communities. We have traditionally also looked separately at those high need communities and done a separate analysis for them to see how they compare to the rest of the county. I'm going to kind of stop there and let Melissa Bauer, who's a whiz at analyzing this data, explain why she wants to and thinks we should use a different denominator for those select communities to get a much clearer and richer picture of what is going on in those communities. So Melissa, I think I'm going to hand it over to you. I hope I'm explaining myself correctly.
Sure, not a problem. And thank you for your kind words. I'm going to share my screen with you because
Can you? I can hardly hear you. I don't know about anybody else.
Oh, I'm sorry. I'll talk. Is that better?
A little better.
I'll hold my laptop up. I don't know why they put the microphones on the bottoms of these things.
I don't know.
So I'm pretty sure at least a few of you will be familiar with this report here. And there was always a question about why the selected communities look like they're doing better, as in they have less of a rate than the overall county. And so when we got the request to create these reports, we were asked to use the denominator for the county. And so when we do that, we're using, say, I'm just going to use fake numbers here. Say Nassau County has 5 million people living in it. If we use that as the denominator for those selected zip code communities, they're never going to look in a way that you could compare them to the rest of the community, because we're giving the rate for the population of the entire county itself, as opposed to the population of just those zip codes. So after a lot of discussion with Janine and Brooke, it looks like the original intent for this report here was to be able to show how much worse those selected communities were doing than the overall population of Nassau County and Suffolk County as well. We did one for them as well. But unfortunately, the way that the request came for information, it didn't allow us to create the denominator that I think would be fitting for this report. I think what the goal is to be able to see the difference between and how much worse the selected communities are doing as opposed to the rest of the county. And so I'm simply proposing that we take those zip coded select communities and gather the denominators that are available publicly for just those selected communities to create our denominator for this report. And then that way you'll get more of an apples to apples comparison, and you will truly be able to say, this is Nassau versus select communities. I don't think that that is what this hospitalization rate currently, well, I know that it doesn't show you. And I think that's what you're really, truly trying to get at. And so I submit that we change the way that the denominators are calculated for this report for all 3 of these years, as well as 2019, once that data is released fully. And then we will be able to recreate this report. And then you'll have 4 years here of tabbable capabilities. So you could select all of them together, or just one, or 1 and 2, however many you wanted to. And I believe that that is going to provide you a more accurate way of comparing those 2 rates and being able to see a more accurate margin of error between the 2 and square root of variance. And you will be able to say, look at how much worse our select communities are doing as opposed to the rest of the zip code, rest of the county. And I think that that is the goal for what we're looking for. And that is really the best way to be able to do that. And it's not the way it's been calculated for this report. So I'm hoping, go ahead.
Can I ask a question then? Would you be removing the results and the numerator and denominator from the rest of Nassau for those selected communities? So like you have the rest of Nassau.
No, yep. So that's how this would be calculated. So I would remove those selected communities. And that is something that's up for discussion. We can give Nassau County as a whole, but right now it's set to remove those selected communities from that rate.
Okay. I mean, that makes the most sense to me, because if you're including them, you're just diluting the difference.
Exactly.
So.
Exactly. Yeah.
Yeah, I mean, as a non-data person, I always have trouble wrapping my head around this, exactly what it means. And I think, and correct me if I'm wrong, Melissa, I used an analogy at one point and I communicated that analogy to you and you said to me, yep, you got it. So I'm going to try and remember if I got this analogy correct. So take for instance, the membership of this work group. It has county officials represented, hospital officials represented, and some community-based organization members. So that's our full group. I want to find out what percent, if I'm getting this right, or what is the rate of just community-based organization representatives who are participating in the meetings. And in order to do that, I had this right at one point, so help me, Melissa, if I get it wrong. So I can figure out, well, so I'd have to see how many community-based organization members I have to begin with. So say there's 10. And then I have to look and see, of those 10, that would be the denominator and how many actually are participating to get the rate. Is that correct?
That would be your percentage of that group that was participating.
So I explained it correctly. I understand it.
Yes.
Linda's saying yes, she was.
Yes. But
Okay.
the difference therein would be, remember we discussed those invited versus those attended. And so to get those invited, you would use just the total number.
Right.
Those attended, you would just use the total number of those CBO organizations as your
Right.
denominator
Right.
instead of the entire invitee list.
Right.
And right
So
now we're
right.
using the entire invitee list, and that is not what we want.
Right. So what we want to be able to understand is however many zip codes it is in the Nassau and in Suffolk, their list, how many individuals or what is happening in the different diagnoses codes that we've decided to investigate, what is happening among those 10, say it's 10 zip codes, add that population together from the US Census, right? We'll look at the US Census
Yes.
data and we'll provide that to Melissa for each of the zip code areas, and that becomes a denominator. We want to be able to see how that group identified as a high need community, how are they doing, for instance, in the area of asthma compared to, are we going to do all of Nassau or just the rest of Nassau?
Here, this one would be the rest of Nassau, but
Okay.
the other one is all of Nassau. So all of this one would be all of Nassau County on this tab.
Mm-hmm.
Then this would be New York State, and this would be New York State plus New York City.
What is it, New York State
With New York City.
with New York City for that one?
Right. So this report wouldn't change because we did really use those appropriate denominators. It's this tab.
Right, it's that one, right. So we're going to, but we could do select communities compared to all of Nassau if we wanted. No, we wouldn't, because we'd be
No, you
already
wouldn't want to do
counting
that.
them
because-
twice then. So we'd be
Yes.
counting them twice. Okay.
Yes.
Okay, so we're going to look at the selected communities. We're going to get the population for each of those zip codes, add that up, that becomes the denominator. And then we're going to basically refresh the 2016, 17, 18, and hopefully 19 Sparks hospitalization data, looking at those measures on the left-hand side.
Yes.
That's what we propose to do.
Yes. And my projection is that you are going to see a huge jump in the rate of those selected and, in Suffolk's case, identified communities, because those really are the high-risk communities. And I really believe that you're going to see a jump in most, if not all, of these measures.
Okay. Okay, why it was done this other way previously, I have no, I don't know.
Yeah, I
Um,
went and I looked back at the actual request for information, and I think it just not enough questions. Unfortunately, it was from before my time.
right.
So not enough questions were asked to try to derive what you were looking for. And as soon as you and I started discussing what you were really looking for is when I realized that's not what got asked for.
Right.
So, which happens, but we're revisiting it. And I really believe that this is what you're looking for now. And I think Linda might agree with me. I'm seeing her shake her head.
Well, it's just, I think we had done a report, I don't know if it was before 2016, and the findings were in the direction that was expected. So maybe in that time we
And
asked for it properly, and this time
yes,
we didn't. I
that's
don't know.
exactly what it is. And I went and I pulled, again, that was before me, but I pulled the request for information from 2013, 14, and 15, and that one is written correctly.
Okay.
So
Thank you.
unfortunately, wires got crossed, and I apologize that it took us a year to discover this, but we will absolutely make it correct, and we will
Yeah.
get there, and we will rerun all these numbers so that you have what you need for all those years worth of data.
Yeah, okay. I don't think anybody has any objection to these numbers being rerun this way. If so, let us know. I know Linda's very happy. And I will talk to my colleagues at Nassau County Department of Health. They're not on this call, but I will talk to them as well and let them know what we propose to do, and then it'll be in the minutes as well. I'm saying, well, I do have somebody, Dr. Davis Pierce. Are you Nassau or Suffolk? I can't remember. I'm not sure if she's with me.
No, I'm Suffolk County with the legislature.
You are Suffolk, okay. I don't think I have any, and I see Grace is on here from Suffolk. Jen, is that Stony Brook's Jen?
Yes.
Hi,
Hi.
hi,
Hi, and
Jen.
Happy New Year.
Oh, Happy New Year. Let's see, Stephanie Courtney. Who's Courtney Freeman? I'm not sure who that is. Courtney?
Yes, I'm here.
Are you're not with Nassau, are you?
No, I'm with Northwell Health.
Oh, Northwell Health. Okay, very good. All right. So I will give a call to my colleagues at Nassau County. And again, this will all be reiterated and summarized in the meeting minutes that we send out in the next day or two. Is there any other discussion? Does this make sense to everyone? I told you this was going to be a short meeting.
I just have a quick question about
Yep.
the community health, the surveys, the 1,105 surveys. Were those pretty evenly spread between Nassau and Suffolk, or did those include the city Nassau and Suffolk, or like geographic? Do you have any breakdown, or?
I haven't looked at the breakdown. I don't know at this point in time what the breakdown is.
Okay.
I'm hoping
Just
it's
curious.
evenly spread. I keep my fingers that it is. I mean, we really tried very hard to get as many responses as we possibly could from across Long Island. But we will break it down because we will say how many were from Suffolk and how many were from Nassau when we do the analysis. So you will know, but I don't know. I didn't look at that number. If you need it right now, we can get that.
No. Thanks. It's fine. I was just curious.
Yeah. It's kind of dependent upon who answers it. We've always had that issue.
Yeah, last year Suffolk County had twice the amount of Nassau County. I'm not sure what it'll be this year.
Yeah. And again, it all depends on how aggressively it's pushed out there. And I know 2020 was a weird year. I can't even believe that we were able to get responses in 2020, although they were very small. It was a very small number. We still got it, but at least for 2021, it was like a 5-fold increase. So that's good. I think that's good. And now all total, I think that we've got to be nearing, since 2013, I would say, I'd have to count. I'd have to go back in and count all the numbers, but it's got to be close to like 15,000 at this point. It has to be. Because it was like 12, 13-ish, and we just added another 1,000. So we got to be hovering in that area. So that's good. So that's where we're at. We're on schedule. Appreciate everybody's efforts in getting individuals to complete that survey. Even though 2021 has ended, our survey continues, although we're not, anything we collect in 2022 will be 2022's included in that year's analysis. But we still, again, always push it out, but are grateful that everyone helped us out, helped yourselves out really, because this data helps you make the right decisions for your communities. Anybody have anything, is there anything else, Brooke, that I need to go over? We're meeting again on the 1st of February. At that point, again, I anticipate it to be a very brief meeting whereby we will be updating you on our progress with the community-based organization key informant interviews. I do not think we will have the CHS survey individual analyses done by then. Melissa, I don't know where you'll be in terms of the refreshed Sparks data at that point, but we might have something to report.
Where we're going to have to redo the contract, which I will send to you ASAP, and we'll get going on it.
Okay. Okay. I guess that's it, unless anybody has anything else to add. We'll meet again on the 1st. Keep our fingers crossed that the COVID cases start to come down by then. And that's it.
Take care,
Thanks,
everyone.
everybody.
Thank you.
Thank you, Melissa.
Thank you, everyone.
Thanks, everybody. Bye.
New Year.